everyone. Thank you for joining us today, and welcome to our second LinkedIn Live session at Javara. Today, we're joined by 3 of our pediatric PIs who are going to be discussing trends in the pediatric clinical trial landscape and talking about how they build trust with their patients and families when enrolling them into clinical trials. My name is Colleen Tenen. I'm the medical director for Javara, and for those of you who are new to Javara, we are an integrated research organization. We partner with healthcare systems to bring clinical trials into the community to offer patients the opportunity to participate in clinical research as a care option. We are located in 7 states with 42 sites and have about 180 active investigators. We have extensive experience in pediatric clinical trials, and we are excited to have some of our current principal investigators join us today to speak about their experiences in the space. Today, I'm joined by Dr. Sementek, Dr. Blair, and Dr. Pryor. And I'm just going to start by asking everyone to give me a brief introduction to yourself and your practice. So Dr. Sementek, could we start with you?
Sure. Hello. I am Dr. Katie Sementek. I'm a pediatrician at the Mankato Clinic, which is a medium-sized multi-specialty group in Mankato, Minnesota. I have been at the clinic my entire career for 17 years, and I have been with Javara a little over 2 years.
And Dr. Blair, can I send it to Texas now?
You bet. Dr. Ron Blair here from Dallas, Texas. The name of our practice is Forest Lane Pediatrics. And I had the opportunity to join up with Javara really in September of 20. So it's been about 3 years and 10 months, and it's been awesome. Learned a tremendous amount. It's been a whole new facet of practicing medicine. And so, I'm looking forward to talking to you more about it.
Great. And Dr. Pryor?
Hi, I'm Dr. Tequila Pryor. I work at First Georgia Physicians Group. And we have 2 locations, Fayetteville and Peachtree City. We are a multi-group or multi-specialty private practice. I have been in practice for 8 years now, and I have been working with Javara and being a principal investigator for about 3 years now.
Thank you. So I'm going to get into some questions. You're all practicing pediatricians on top of being clinical researchers. So I thought, Dr. Pryor, could you maybe describe how your clinical practice enhances your skills as a clinical researcher?
Absolutely. So definitely being a pediatrician, we just get the privilege of being able to watch our patients grow from little newborn babies to young adults. And with that just comes really an opportunity to build a good relationship with our patients and their families. And the foundation of that is trust. We want our patients and the families to come and basically lean on us as a unbiased source of information as we are helping support and navigate our families and our patients through just every aspect of just regular life and any lifestyle changes that may happen during their lives. And so with that, it just allows us to have a unique opportunity. So when we are approaching our patients and our families with any sort of like clinical trial, that trust is already been strongly founded, and they are looking to us, as basically providers that we know that we have our best, that we have the children's best interest at heart. And we've just seen that relationship or that trust kind of get a little bit more fragile, especially during the COVID pandemic, where there has just been a little bit more, mistrust in the medical community. So even more just making sure that our families know that we do have their best interests at heart.
Yeah. And Dr. Sementek, have you balanced the same thing in your past 2 years of being a researcher?
I absolutely agree with Dr. Pryor. And I think even building that trust further is that patients know that in this type of research, primary care combination, we're going to be with those patients for the long term. We're not just with them for this study and then we don't ever see them again, but we are going to take care of them for that period of time and then through the rest of their childhood. And that has implicit trust in the process too.
Yeah, great point. I think what I always remember hearing in pediatrics is that these pediatric patients are not just little adults. There are unique sensitivities that may go into recruiting pediatric patients for clinical trials. So I was wondering, Dr. Blair, could you tell me a little bit about how you address, the barriers you face and how you address them and overcome them?
I think that initially it was just addressing my own thoughts about, how clinical research usually takes place in the ivory towers. And so I didn't realize, and Javar opened my eyes to the fact that clinical research is really best practice, right there in the clinic, and where you can work with your own patients, where, like Dr. Pryor says, you developed a long-standing relationship of trust and well-being. And so I think the common denominator for all of our sponsors and for Javara and for our practice is patient safety is number one. And so if you kind of keep that in the forefront when you're talking with patients, then I think that's a big help. And so if you are able to offer things to your patients that could be a vaccine or a medication or some type of nutrition or a device that is actually, you believe is a very promising thing and something that you believe in, then it's very easy for that to translate over to your patients. And so those people where it's a good fit, then they may be willing to try it. I think the other part of that is we have a pretty large practice and with 4 offices. So now we have several other people who've become principal investigators as well as sub-investigators. And so our entire clinic is involved or all of our clinics are involved. And so I think that it's important to develop like IRB approved materials where you have pamphlets or brochures or posters. And then I usually, once a month, I'll give all the participating physicians a laminated sheet that has the current trials with the inclusion and exclusion criteria. And so that it's staying in the forefront of their minds. And those are, probably quite a few of the things that we've done. But again, I think understanding its patient safety is number one, and participating in those trials that you think offer significant benefit to your patients where they don't have access to it in another venue. I think those are things that have been helpful with us.
Great. Yeah, thank you for bringing up that emphasis on patient safety, because that's obviously always very important to us. Dr. Smentek, you've done a really great job helping us provide some meaningful feedback on protocol designs to some of our sponsors and CROs that we work with. So in your opinion, why is it so important to incorporate this type of physician feedback when they're designing protocols that are going to be implemented in pediatric practice?
I think it's really easy for us, like Dr. Blair was saying, to really know what is in the best interest of the patient from the sort of eyes of a physician. So being able to analyze those studies and say, is this really in my patient's best interest? We also have the ability to say, will this place an undue burden on my patients? The first thing I look is how many lab draws is this study gonna take? Because there's only so many that you can make a kid go through before either them or the parents say, nope, that's the deal breaker. Another example, I had a study come through that had multiple MRIs as part of the study protocol. And while for an adult, that's not a big deal, for a child, that could mean they're sedated multiple times. And then the risk-benefit analysis changes quite a bit. So we're able to give that feedback to study organizers and say, hey, maybe think about this, how necessary, how many do you actually need to get the data that is important to you?
Yeah, that's great. As an internal medicine physician, blood draws, mean very little to me compared to what it might mean for an infant. So, it's always helpful to get that pediatrician point of view. Dr. Blair, you are also someone who gives us some really great feedback on protocol designs pretty early before we take on any studies. Anything else you had to add here?
Well, I think you have to look at what are the things that your clinic does day in and day out, and are you really good reading EKGs? Are you really competent to do that? Are you competent to interpret any type of X-rays? You want to stay within your bounds, but what I've found is that Javara has been able to provide us with people who can do things like interpret pulmonary function studies, or help us with interpreting EKGs and things, so that it clears people for their inclusion criteria. We want to be able to do the things that we do day in and day out and do them well. We have expert phlebotomists that are, just pediatric trained, and they draw blood in our clinic every day, even outside of our research clinic setting. So that type of skill is something that just has to be maintained like day in and day out. I think that those require special people with those skills and interest. So those are a few of the things that have been helpful.
Great. And I think we mentioned, but all three of our investigators here were naive, relatively naive to clinical research, especially sponsor-based clinical research, and have become successful over the past few years. But I'm sure there's a lot of lessons learned that come with that. So Dr. Pryor, I was wondering if you could talk about any, lessons you might have learned after your first few trials that shaped how you took on trials in the future.
Yeah, so I think the biggest lesson that I learned was to really just kind of look beyond just my individual patient panel, and to think big picture, like community level. And actually my internal medicine colleagues really kind of helped me encourage that when getting basically, the emails for some, potential clinical trials, was to really think bigger. And then just, going back to what Dr. Blair said, I know that I had some concerns where there were things that I didn't think that we could do in the clinic, but Javara has been great with providing resources where we may not, have personnel staff that are trained to do that, but that was not an actual limitation to the study.
And Dr. Sementa, can I pose the same question to you about any lessons learned over the past few years?
One of the lessons that I picked up was that my introducing research to other specialists within my practice was also beneficial to me. So I started out as the first PI in our organization, and then was able to add in multiple of our specialists and family practice doctors. And what I have found is that those are also gateways to getting patients for my own studies. For example, somebody's grandparent did an elderly RSV vaccine study, and they were excited to be involved in research. And then when something comes up for their grandchild, they can reinforce the positive experience they had with research through Javara and through the Mankato Clinic. And that makes my recruitment that much easier.
Great. I think that's helpful, because what we've tried to do is really sort of build awareness of clinical research as a whole, without it being as study specific. So the more people are aware that that's something that's offered at your practice, the more receptive they'll be in the future when we reach out for study opportunities. Dr. Blair, you mentioned a little bit about how you speak to other doctors. I was wondering, I know your site uses a lot of creative tactics to build awareness of clinical trials in your practice, around your community. Can you speak to us about any of those that how you've tried to build awareness about clinical research, both in your practice and in the surrounding area?
Absolutely. I think that, when you are doing something that you're passionate about, then it rubs off on almost every aspect of what you're doing. And so I think it was interesting that you mentioned the grandparent, because some of my colleagues and board members and people, they hear me talking about the clinical research and what's going on. And I had a person who's a grandfather refer his grandchildren over for one of our trials. It was basically because I'm enthusiastic, and one of the personal things that happened was that you get to see yourself published sometimes. And I never really thought that that was something that I would do. And so other people, we have a large multi-specialty group that we're part of. And so when somebody does something that deserves some recognition, and then, that comes in the publication, and just like your monthly newsletter. And so, it's a whole community of physicians that we're all working with. And I think if you talk about what you're passionate about, I mean, you don't want to talk people's ear off. They're not interested. But, if you're having fun, it's just, I never realized that I could do my day-to-day practice of medicine and at the same time identify patients that would be a perfect fit for certain studies. And then at the same time, then I've known that patient or that family for quite some time. And I'm not going to try to approach people that I know that would be inappropriate. But it's opened a lot of avenues just by talking to other physicians. But I've had some OB-GYNs that have joined because of some of the mother-baby studies and trials that we're able to participate in, and that's been fun. And I can't get enough family medicine or internal medicine people to join. We've been able to get pediatric endocrinology and pulmonology. And I'm, talking to my other colleagues about joining in other specialties. But I think it just comes through with when you're talking, if you're sincere about, doing things that are for your patients that can be helpful, that are not otherwise available to them.
Great. And I'll leave this, Dr. Smentek or Dr. Pryor, whoever wants to take this one. But I'm sure you're talking to your patients about their trials, the parents too. What kind of, when you hear feedback from the patients and the parents, what kind of trials are they most interested in? What are they looking for more of?
I will say in my practice.
I can start.
Oh, go ahead, Dr. Pryor.
Dr. Smentek, go ahead.
Okay, I'll start. I will say they're looking for treatments for diseases or issues that we don't have a lot of treatments for currently. So if you say RSV anything, parents will be interested, because that is something that we don't have a lot of good interventions for at this point. The other one, in a smaller community like mine, anything that's more difficult to access in a smaller town is also very much appreciated. Asthma treatments, we don't have a pediatric pulmonologist in our community. ADHD treatments, anything where they would otherwise have to travel a long distance to get that care.
Dr. Pryor, are you seeing anything different?
No, actually seeing the exact same thing as Dr. Smentek. And I would say just things that are relevant to their day-to-day lives. Another topic that's come up is weight loss and obesity. So making sure that our kids are staying healthy. But yeah, definitely anything, especially infectious wise, that is getting a lot of media coverage is definitely a good, interesting point for our patients and their families.
Great. Dr. Pryor, I'm going to give this last question to you, but anyone else can chime in afterwards if you want to. But how does your partnership with Javara allow you to incorporate research into your already busy medical practice?
So Javara does a great job at, I think, just working as a good liaison between the sponsors and the clinics in the community. So just really kind of helping streamline projects that are really applicable to our patient population, but also just making the process a lot easier for our day-to-day function as pediatricians. So having specialized staff that can do blood draws or that have specialized training with certain, pieces of equipment like spirometry and things like that. But really just they actually make it doable, because I remember when I was first approached, I was like, can I still do this and practice? And I just know people that do research full time, and how do I, actually integrate that into what my day-to-day, duties as a pediatrician. And I have to say the amount of support that we have to actually be able to make this a possibility has just been phenomenal. So I am just so excited about our team here in Fayetteville. I mean, they're wonderful, from patient engagement, recruitment, I mean, everything. Having someone that can immediately come down stairs and talk to our patients, and maybe even do an informed consent, at that particular point in time in real time is really really nice, because once the patients leave the office, trying to get them to come back in for, more paperwork and more talking is sometimes a little difficult.
Great. Well, we feel very lucky to have all of you as our advocates in research as we continue to grow and expand. I really want to thank all of our panelists today for sharing all of these insights, and we hope you enjoyed our discussion with our physician investigators. If you're interested in learning more about clinical research as a care option or how your practice can get involved in research, please reach out to Javara. If you have any pediatric trials in your pipeline and you're interested in chatting about how Javara can expedite enrollment with our access to over 5 million patients, please contact us and we'd be happy to follow up with you. Thanks again for joining, and thank you again to all of our panelists.